and 6 out of the 8 major death causes around the world are related to tobacco. It also affects the global economy. Every year, because of tobacco use, according to the World Health Organization, about 1.8 trillion US dollars of economic losses are incurred as a result. The Hong Kong government has been abiding by the principle of taking gradual and multi-pronged approaches in enhancing tobacco control. And over the years, we have been taking forward our tobacco control work under this principle. We enacted the Public Health or Smoking Public Health Ordinance in 1982. That was the first piece of legislation enacted to tackle the use of tobacco. Since then, we have set up non-smoking areas in 1983, and we further expanded the NSAs to cover public transport vehicles in 1992, as well as indoor workspace and restaurants in 2007. In 2001, we set up the Tobacco Control Office. And we also raised tobacco duties respectively in 2011, 2023, 2024. In 2022, we took resolute action to call a halt to ASPs, alternative smoking products. We have yielded significant results, and we've set ourselves as a successful example for the world. In 1980s, the smoking prevalence in Hong Kong was 23%. It has come down since, and it reached 9.5% in 2021. In 2023, the smoking prevalence further came down to 9.1%. Dr. Ronald Lam, the Director of Health, will report to you the major findings of our survey in this regard. Now, we have not relaxed our effort. In 2018, we set a target, and that is by 2025, the smoking prevalence should be further lowered to 7.8%. That means we need to step up our efforts to take forward tobacco control in order to meet this target. In the third quarter of this year, of last year, we started a public consultation exercise. We're going to report the findings of the consultation to you in the following. There are 4 strategies set out in this consultation document, and that is regulating supply, suppressing demand, banning promotion, reducing attractiveness, expanding the non-smoking areas, mitigating harm, and enhancing education, supporting cessation. 90% of respondents in general support the idea of further lowering the smoking prevalence in Hong Kong. And there is also broad consensus that Hong Kong should become smoke-free. In mapping our way forward, we will have regard the findings of the consultation exercise, and we will also consider the effectiveness of reducing the public's exposure to secondhand smoke, the public's acceptance of the implementation of the measures to be implemented, as well as difficulties in the implementation of measures and possible conflicts. So we have devised short, medium, and long-term measures as our next step. We have 10 short-term measures. Our goal is to submit the legislative amendment proposal to the Legislative Council by the end of 2024, so that within the legislative session we will be able to pass the bill. We will review the implementation of the short-term measures, and then We will explore the implementation of medium-term measures after 2026. We will also further explore the long-term measures for the purpose of making Hong Kong smoke-free. These 10 short-term measures come under the 4 strategies. They are: 1. In relation to regulating supply, we will go after illicit cigarettes as well as the cheap whites. That means we will introduce a duty-paid labeling system and increase the relevant penalties for duty not paid cigarettes. We will put in place a complete ban on alternative smoking products, and we will also prohibit the underage from getting access to tobacco products. We will also, on a continuous basis, review the tobacco duty levels. On banning promotion, reducing attractiveness, we will call a halt to flavored cigarettes, and we will also require health warnings to cover entirely the packaging of cigarettes. We will expand NSAs to reduce the harm. That means we will stop people from smoking while queuing up, and we'll also expand the NSAs and increase penalties. Finally, on enhancing education and supporting cessation service, we will enhance education as well as smoking cessation service.
Now we invite Director of Health to tell us about the outcome of the consultation. Good afternoon. I will now tell you about the results of the 2023 thematic household survey. We interviewed 11,000 households and 23,400 people were interviewed, and the responding rate was 76%, which was very high. As mentioned by the Secretary, according to the survey, people aged 15 or above, over the past few years, the smoking rate has been on decline. As at 2023, the smoking rate was 9.1%. That means every day we have about 577,300 people smoking every day. As mentioned, compared to the recommended target of the WHO, well, we want to achieve a 7.8% smoking rate by 2025, and there's still a gap between our target and the existing smoking prevalence. You can see from the chart here that the number of male smokers are on decline, and the percentage as at 2023 is 16.4%. That means about 488,500 males are smoking every day. For females, the percentage is 2.7%. That is 88,800 women. Over the past 20 years, the smoking rate for women ranged from 3 to 4%. Therefore, we have to enhance tobacco control measures targeting females. If you look at the age groups, for those aged 14 to 49 and those aged between 50 and 59, the daily smoking rate is the highest for these two age groups. Together, they account for about half of the entire smoking population. That represents 275,600 people. These people have smoked for quite a long time compared to other smokers. If we do not enhance tobacco control measures against them, in the long run, they are going to bring burden to our healthcare system. Our survey also looks at the situation with flavored tobacco products. If you look at the situation by gender, if you look at the pink bars, over 60% of female smokers are having flavored tobacco products. That means more females are opting for flavored cigarettes compared to male. And Among them, a lot of the flavored cigarettes are mint cigarettes. 60% of the female smokers, for the first time they smoke, they pick flavored cigarettes. The younger the smoker is, the higher the chance they pick flavored cigarettes. For those aged between 20 and 29, over 2/3 of them consume mint cigarettes. For those aged below 50, over half of them opt for flavored tobacco products as well. Again, most of these flavored tobacco products they pick are mint cigarettes. If you look at first-time smokers, the same situation applies. The younger the smoker is, the higher the chance they consume flavored tobacco products. For those aged between 20 and 29, about 70% of them pick mint cigarettes when they smoke for the first time. Over 40% of smokers, they consume flavored cigarettes in general. On the survey concerning smoking cessation services, about 600,000 people, that is over 80%, they are aware of the smoking cessation services. However, over half of them, they do not take the initiative to seek help or take the initiative to quit smoking. This shows that we can step up our efforts in promoting smoking cessation services. That's all from me. Thank you. Now I invite Ms. Louise Ho, Commissioner of Customs and Excise, to tell us more. The Customs and Excise Department combats illicit cigarettes on all fronts. In terms of enforcement, we strive to intercept illicit cigarettes at source and gather intelligence through international collaboration. This enhances our enforcement effectiveness. Over the past few years, we're seeing an increasing amount of illicit cigarettes seized. Starting from 2020, we're seeing a significant increase in terms of the number of illicit cigarettes seized. This shows that it is due to the change of our enforcement strategies and enforcement efforts. Back then, we were yet to see an increase in tobacco duty. That means the amount of illicit cigarettes seized a year has no direct relation with the increase of tobacco duty. The seized illicit cigarettes, apart from being supplied to the local market, part of them are temporarily stored in Hong Kong or re-exported to neighboring regions. Therefore, an increase in the amount of illicit cigarettes seized does not mean that they will necessarily enter the local market. Well, some say that by raising the tobacco duty, we're going to see a more active illicit cigarette market. Well, according to statistics from the Customs and Excise Department in 2023, when we saw resumption of normal travel, we recorded 2.972 billion duty-paid cigarettes compared to 2019, that is before COVID. We got 3.374 billion duty-paid cigarettes, representing a drop of 12%. This drop from 2023 is comparable to that in 2019, with a lower smoking rate and fewer duty-paid cigarettes. The revenue from tobacco duty compared to 2019, we got $200 million more. That means more tax does not mean fewer revenues from tobacco duty.
Now we compared only the figures in 2019 and 2023, but not the amount of illicit cigarettes seized and tobacco duty revenue in 2022-2021. That is because in 2023 there was a full resumption of normal travel. The situation was very different from that in 2020 to 2022. So no direct comparison could be made. Between 2020 and 2022 during the pandemic, very few people left Hong Kong for traveling, and it was impossible to bring in any duty not paid cigarettes for self-use from outside the territory. The demand for local duty-paid cigarettes therefore substantially increased, 20% comparing to 2019, averaging about 4 billion cigarettes. Every year before the announcement of the budget, there would be a chance that tobacco duty might be raised, and as a result, the Customs and Excise Department would mount major operations to tackle illicit cigarettes. And also, this will take place at across the BCPs as well as across the territory. Between February and May this year, we commenced a major operation with the cold tempest. We neutralized 4,726 cases. We seized 139 million cigarettes and 1,630 kilograms of other tobacco products. We also arrested 4,347 people in the process. The Customs and Excise Department has made an all-out effort to tackle the problem of illicit cigarettes, but as far as enforcement is concerned, we still face a lot of difficulties and challenges. First, as cheap whites, there is no definition as far as our laws are concerned. Their packaging is no different than the duty-paid cigarettes available in the market. Some of them even come with health warnings, and they are sold at the price lower than, at a very low price, or even lower than the tobacco duty price. Under the current mechanism, no consignment of cigarettes is specified in the import permits. The packaging of cigarettes doesn't come with any identification of the consignment. So the perpetrators would often sell duty not paid cigarettes as duty paid cigarettes which come with proper import license. So in terms of enforcement and the collection of evidence, we do face a lot of difficulties at the retail level. And in recent years, we have seen prevalence of cheap whites in the market. The amount of cheap white cigarettes seized by the C&E department increased from 3 to 5% in 2022 to 17% in the first 5 months this year. This trend shows that more effective measures are warranted to tackle the cheap whites. The second problem is a lack of deterrence in our laws. The Dutiable Commodities Ordinance provides a maximum penalty level for illicit cigarette offences, but it's on the low side, and the sentencing tariff cannot reflect the seriousness of these cases. It doesn't generate sufficient deterrence. Another problem is that illicit cigarette syndicates are organized, and the modus operandi becoming more and more serious, and we do not have effective means to investigate and crack down on syndicated illicit cigarette smuggling and go after their criminal proceeds. The Deputy Secretary for Health will brief you on the outcome of the public consultation exercise. Yes, I'd like to brief you on the outcome of the consultation exercise conducted between July and September 2023. We received feedback from respondents through online and paper-based questionnaires, and we respectively received over 10,000 such questionnaires through online and paper-based questionnaires. We also conducted telephone interviews in the form of random sampling on over 1,000 respondents. Now, apart from that, we held focus group discussions, and the Hong Kong Council on Smoking and Health also dished out questionnaires and collected some 4,000 questionnaires. We received signatures from 14,000 members of the public, as well as inviting 38 schools to sign charters covering some 20,000 teachers and students. We also received individual feedbacks from 450 members of the public, giving us their support to make Hong Kong smoke-free. Over 90% of respondents are of the view that the government should roll out measures to further lower the smoking prevalence. And in the consultation process, we asked questions in relation to the 4 strategies. On regulating supply, the major findings are that 90% of respondents support strengthening our efforts in illicit cigarette smuggling, and 88% of respondents agreed that we should stop supplying tobacco products to the underage. 84% of respondents agree that we should prohibit the import of alternative smoking products. 88% of respondents agreed that we should regulate flavored cigarettes. 83% agreed that we should make the packaging less attractive. 85% agreed that we should prohibit smokers from smoking while walking, and there is also support for expanding the non-smoking areas. 4th strategy is enhancing education as an ongoing effort. This is also our focus. Over 80% of members of the public support collaborating with the education sector to enhance education, as well as collaborating with the primary care sector. We analyzed the views received, and having considered the implementation aspects of the measures, we have finalized a basket of short, medium, and long-term measures. And I will first go through the short-term measures. There are 10 of them. The first one is to introduce a duty-paid labeling system. Like the Commissioner of Customs and Excise just commented, in order to make the enforcement strategy more effective, we will introduce a duty-paid labeling system. In other words, we need to devise a system to differentiate duty-paid cigarettes from duty-not-paid cigarettes. We will also amend the legislation. If cigarettes are sold at a level lower than the tobacco duty prevailing at the time, then the seller will be responsible for providing proof that these cigarettes are duty-paid ones. So it's for the seller to prove that. We are also going to increase the relevant penalties. The maximum penalty at this moment is $1 million fine and imprisonment of 2 years. We propose increasing the penalty to $2 million and an imprisonment term of up to 7 years. And we also propose listing the relevant offences in the Organised and Serious Crime Ordinance schedule so as to freeze the relevant proceeds. Now, under the Dutiable Commodities Ordinance, we allow the relevant penalty, and that is a $2,000 fine. We will increase the penalty. The third measure is to introduce a ban on ASPs, alternative smoking products. We've achieved a broad consensus. You may recall that a few years ago, the Legislative Council passed a bill to ban the alternative smoking products. And it's been 2 years since then, and that we have banned the import, promotion, manufacturing, or sale of ASPs for business purpose or possession for business purpose. In other words, members of the public should not have a legal avenue to access the ASPs at the moment. So for those who are still in possession of the ASPs, the only reason is that they still have some stock left, so to speak, before the ban took effect on the 30th of April 2022. We believe that we should take further steps to ban possession of ASPs once and for all. The government will appoint a commencement date for this to take effect. The fourth measure is to ban the supply of tobacco products to people under the age of 18. It is our responsibility to protect our youth. At the moment, we prohibit the sale of tobacco products to the underage, and we will take it one step further. No one should supply tobacco products to those under the age of 18.
Fifth, we will continue to review the tobacco duty. Over the past 2 years, we have increased the tobacco duty. Moving forward, we will continue to assess the effectiveness of tobacco duty increase. Sixth, in terms of banning promotion of flavored tobacco products, as mentioned by the director on the thematic household survey, young people and women are subject to big impacts posed by flavored tobacco products. Tobacco products make use of additives and special flavors to reduce the irritation on throat. The additives also lower the awareness of or vigilance of smokers on these flavored tobacco products, and this makes people harder to quit smoking. That's why we suggest that fruit-flavored or mint-flavored tobacco products should be banned. Seventh, on graphic health warnings. Since 2017, over 85% of the package of cigarettes have to be covered by graphic health warnings. However, there are still logos of certain brands or graphics that entice people to buy cigarettes. Therefore, we're going to step up measures to standardize the design and warning markings on cigarette packaging. This will reduce the appeal and attractiveness and marketing effect of cigarette products. Also, we intend to, through legislation, prohibit smoking while waiting in a queue. Many people feel disturbed and annoyed when they get second smoke while waiting in a queue. While you're waiting in a queue, you're forced to breathe in second-hand smoke. So to respond to people's aspiration, we propose to, through legislation, prohibit smoking while queuing. We're going to adopt a progressive approach. For the first phase, We propose to prohibit smoking while queuing to get on a public transport or while queuing to enter themed park, public playgrounds, or public healthcare institutions. We often have to queue to get into public swimming pools or themed parks and so on. So we are going to work on these premises first. Ninth, we are going to enhance the number of no smoking areas and increase penalty. We're going to expand NSAs to cover childcare centers, schools, elderly care homes, as well as designated areas in public hospitals and healthcare institutions. In fact, the indoor areas of some of the above premises are already no smoking areas, while our elderly and children are often using these premises. We want to include the entry and exit areas of the above premises as no smoking areas as well. We're also going to expand no smoking areas through designating specific times. We got feedback that we should enlarge some of the no smoking areas. So that's what we are going to do. Now on penalties, currently the fine is $1,500 if you smoke in statutory no smoking areas. And this has been the case since 2009. That means the fine hasn't been adjusted for years. Therefore, we now propose to increase the fine to $3,000. On enhancing smoking cessation service and promotions and education, these are all fundamental to tobacco control. During the No Smoking June campaign, we mentioned that we are going to roll out the Chinese medicine ear points patches. We're also going to provide cessation services for our members in district health centers. For members whose family members who want to seek help to quit smoking, we're going to offer services to them. Local pharmacies are going to work with district health centers, and drugs will be provided to those who want to quit smoking and members of district health centers. They're going to get counseling services as well. For medium and long-run measures, should we reduce the exposure of tobacco products at retail outlets? Should tobacco companies comply with certain requirements in terms of sales of their products? Also, we're exploring the feasibility of banning smoking while walking. We have looked into this. We think that we will face difficulties with law enforcement. That's why we will spend some time to study similar or comparable legislations in other places in the world to see how we can implement such arrangements in Hong Kong. We're also going to continue to expand NSAs to see if premise managers should hold up more responsibilities. We will also continue to explore the following measures, that is, whether we should ban the provision or sale of tobacco products to people born after a certain year. We're also thinking whether there should be a mechanism for us to review the tobacco duty level as recommended by the WHO. We will also think about the specifications for tobacco products, for instance, the amount of nicotine involved in tobacco products, as well as the standardized appearance of cigarettes. Thank you.
The floor is now open. If you want to ask questions, please use the microphone. And before you ask your question, please tell us which media outlets you represent, and please be succinct as we have many journalists here. Please limit to just 2 questions at a time. This lady over here. I'm from Cable. Good afternoon. I'd like to ask questions about the consultation findings. The majority of the public is in favor of putting a stop to walking while smoking, but you mentioned some enforcement challenges. Can you tell us more about enforcement challenges? What are they? There is also a complete ban on ASPs, not only alternative smoking products. I mean, why are you only banning ASPs but not other traditional tobacco products? Deputy Secretary. About the so-called train heads or banning walking while smoking, we considered this option in depth. We need to have regard to the actual implementation. For example, how do we define walking while smoking or train heads, so to speak? We need to give it a definition first and foremost, and as far as implementation is concerned, how do we define a motion as walking? What if somebody just stops walking? How should our officers take enforcement action? Now, of course, we understand the views received, but if we are to empower the law enforcement agencies to take enforcement action, we need to have clarity to avoid disputes and challenges. Next, ASPs. What did you refer to? You propose banning all ASPs. But what about traditional tobacco products? You're not putting a complete ban on tobacco products in general. Why just ASPs? Well, I think Deputy Secretary already answered that question. In 2022, the 40th of April, because of the broad consensus forged, the bill was passed to stop the import, manufacturing, possession for business, the ASPs. And since then, it's been 2 years. Members of the public in Hong Kong would not have any legal avenue to buy the ASPs, and we believe it's high time that we stepped up control, because they should have finished whatever stock they have, and we believe that we should take it further to stop or regulate the possession of electronic cigarettes or other ASPs. At the time, we allowed time for the public to use up the stock they had. This lady in blue.
Question from TVB Pearl. First of all, I would like to ask, how can authorities ensure underage individuals that they will not touch or be able to get any cigarettes from people who are like from adults or people they know, their surroundings? Like, how can authorities ensure that? Because in one of the short-term policies is that the government will ban people from sharing cigarettes to people under 18. So I was wondering, how could authority ensure that measure could be carried out effectively? And secondly, regarding the other measure like no smoking while queuing, and how can authorities define that, like how many number of people in a queue? So yeah, how can authorities define the definition of queuing in that circumstance? Thank you.
May I invite Mr. Lee to answer the questions?
Thank you for the question. About the rule banning provision of cigarettes, tobacco products to underage individuals, I think the key principle is that we want to protect our youngsters, our next generation. So what we are doing now is actually education process, a cultural change, a behavioral change. So apart from setting this new rule, I think another important aspect is that through education, through promotion, we will educate our young people that they should not receive tobacco products. At the same time, we send a very clear message to the adults that one should not sell nor should one provide such tobacco products to our young people. And on no smoking while queuing, I think queuing is a behavior that we Hong Kong citizens is very familiar with. It is a typical behavior in our society. So queuing, I think, is quite straightforward. But at the same time, we will work out with our lawyers during the drafting stage on how best we could institute this concept into our proposed legislation. Thank you.
Next question. Third row, this gentleman in black. I'm from Singtao. A question for the Commissioner. You mentioned that after legislative amendments, the tobacco duty price should be set out vis-à-vis the retail price of the cigarettes. Can you tell us more? And about the frontline enforcement staff in the Tobacco and Alcohol Control Office, will you consider increasing manpower to make sure that there will be sufficient enforcement strength to implement the new law? The Commissioner will take the first question, and then Dr. Lam will take the second question. Thank you. The government will propose legislative amendments to the effect that unless there is evidence to the contrary, if a seller sells a packet of cigarette below the prevailing retail price of $65, then an inference can be drawn that these are dutiable commodities. Well, this measure is targeted towards the cheap whites. In other words, for cigarettes or cheap whites sold below the dutiable value, then unless the seller could provide evidence that duty has been paid for these cigarettes, then the C&E department could rely on the presumption that these cigarettes are duty not paid cigarettes and hence take enforcement action. Now, as explained just now, the onus of proof falls on the sellers. The current challenge facing the customs and excise is that there is difficulty when taking enforcement action against the cheap whites. A lot of manpower and time are required to collect evidence. And during the enforcement process, many vendors would tell us that they have no knowledge and they were told by the supplier that these cigarettes are duty-paid cigarettes. Upon further inquiry as to the actual supplier of the cheap whites, these sellers are unable to provide information to the customs and excise
per pack, then we can assume that they are duty not paid cigarettes. Otherwise, traders are making huge losses. However, due to existing legislations, we cannot do anything about these cheap whites. It is unlawful to sell or import cheap whites. Buying these cheap whites are also against the law, so please be careful. On the manpower, I will invite the director to tell you more. Thank you, Secretary. We have inspection officers under TACO. We have in total 200 such inspection officers taking enforcement actions within the civil service establishment. We have various tobacco control measures. We have an established mechanism for taking enforcement actions. The government can, in accordance with the established mechanism, apply for additional resources for such actions. There are many no-smoking areas in indoor and outdoor premises in Hong Kong. Over the years, we, through inspections and complaints we receive, take enforcement actions. We see huge effectiveness for a lot of our tobacco control measures, and you see that there are many NSAs in Hong Kong. And we do not only rely on inspection officers to take enforcement actions. It is about creating a culture in Hong Kong, and we also have to have concerted efforts in the community to build a smoke-free Hong Kong. We are also not on our own in terms of enforcement for venue management. We rely on cross-departmental efforts. For certain premises, we work with the police, the Customs and Excise Department, or the Health Department to implement our tobacco control measures. Every year, we review the effectiveness of our law enforcement actions to see if we can more effectively make use of our resources in law enforcement. Thank you. The gentleman on the second row in blue. Thank you. Good afternoon. I'm from Ming Pao. On the justification to ban smoking while queuing, you mentioned that you got a lot of feedback from the public. Through what channels do you receive such feedback? Are there any examples for such legislations overseas? Compared with smoking while walking, smoking while queuing is not as serious in Hong Kong. Is it because you cannot enforce the ban for smoking while walking? That's why you opt to prohibit smoking while queuing? Also, it is quite controversial to ban the provision of cigarettes or sale of cigarettes to people born after a certain date. We see that there are difficulties to enforce such law in New Zealand. What is your view on this? Secretary, please. I will take the question about the provision of sale or of cigarettes or smoking for people born after a certain year. And then my colleague will respond to the other questions about smoking while queuing. As we consider different measures, we take into account the impacts and effectiveness of these measures. We take into account public acceptability and whether it's possible for us to enforce or implement these measures. Prohibiting smoking of people born after a certain year is an ultimate tactic. It is a goal for achieving tobacco endgame. We do not only consider the situation in New Zealand, we take a holistic approach. We consider the situations of different places in the world. We understand that this might be controversial, so we'll need more time to have further discussions on how we can implement such an arrangement. So this will be our long-term measure. This current term government will end on the 30th of June 2027. We won't say we will definitely implement or not implement this measure. We will propose or tell the public about our decisions of the medium and long-term measures after 2026. On the question about smoking while queuing, I will invite Mr. Lee to respond. The prohibition of smoking while queuing is not a new idea. If you look at the outcome of the public consultation, over 90% of the respondents support the expansion of no smoking areas. The reason behind is that people do not like secondhand smoke. A lot of people said while they are waiting at bus stops, they find it annoying or disgusting to see other people smoke. There are no smoking areas only at bus terminuses or transport interchanges. However, at taxi stands or mini bus stops, there are no smoking areas currently. Many people told us that they feel disgusted to have smokers queuing in the same line with them because they cannot go away. So we would like to respond to the public aspiration to prohibit smoking while queuing. There are similar arrangements in places such as Singapore and Beijing. There are arrangements to ban people from smoking while waiting in a queue. The gentleman there in the third row.
English questions from the South China Morning Post. The first question, the government here seemingly has opted for these easier measures, such as banning smoking in queues in the short term, instead of going for it's tougher measures, such as banning cigarettes for people born in a certain year. How effective do you think these short-term measures will be for curbing smoking? And is there any specific reasons that the government have not considered these harsher measures, either in the mid-term or the long term, sooner? And the second question is, how would the government respond to criticisms that it's restricting the freedom of choice for residents by restricting smoking in queues, banning alternative smoking products, and even flavored cigarettes? And also, is the government worried that this would harm the city's popularity from tourists or overseas talents or even local expats? Thank you.
May I invite Professor Lo to ask the questions?
The first question, I think as I've explained in the introduction, we are taking a multi-pronged and, more importantly, an incremental approach in implementing all these anti-smoking measures. We understand that some people may have already been smoking for quite a long time, and in order to try to change some of the behavior, we need time for them to adapt. As I've explained in the introduction, over the last 40 years, we have been taking this incremental approach. For example, when we first started to restrict smoking in indoor area, we took an incremental approach. Firstly, in elevators, in the lower deck of land transports, and subsequently to all indoor area of restaurants, public areas, and so on, and now to the workplaces, etc. So now, while we are extending this to the outdoor area, we would like to adopt the same approach. trying to go for the hardest measure in one go may not be the best approach, because that will create sentiments from people. About your question on the freedom of choice, I'm not sure whether you read my Chinese word in the very beginning, and this is cigarette. The Chinese writing clearly indicated the man, the smoker, being restricted, being held in like a cage. And that is all because of the nicotine and the contents of all these cigarettes causing people to be addicted to smoking. And it becomes so hard for people to quit smoking. So smoker, in a way, they are addicted to smoking because of all the contents of the cigarettes and the tobacco products. And in a way, they don't actually have the freedom of choice. The freedom of choice of not smoking is actually restricted by the tobacco industry. And so we believe that these smokers, they are already deprived of the freedom of choice already. About these flavor cigarettes with additives, the additives are actually like an advertisement. They're trying to hide the irritating smoke, the taste of the smoke, and at the same time hiding the harmful effect of all these tobacco products to make it like a sugar coating on a toxic product. And that is why we believe that we are trying to give our smokers actually the freedom to free themselves from the harmful effect of tobacco products. Thank you.
好，下一位嗰邊最過嗰位女士嘅第一行最嗰位女士。
This lady over there.
Then the first question is, are there any, despite the authorities is planning to table the enforce the amendment bill to legislative council by the end of this year, are there any timetable for the ban on alternative tobacco products to be enforced? How long will be the grace period for those people to handle, those smokers to handle their remaining alternative tobacco products on their hands? The second question is, given that the smoking rate in 2021 is still being 9.3%, and the smoking rate last year has been 9.1%, but the targeted smoking rate next year will be 7.8%. Does the authority still confident that you can achieve that target by next year when your short-term measures may be introduced after this year? Thank you.
Professor Low, please.
I will answer the questions about the target of smoking rate of 7.8% first. Now we understand that our smoking rate in 2021 is 9.5%, and 2023 is 9.1%. And going further to this 7.8% seems a big increment. But I need to remind everyone that this target of getting to a smoking rate of 7.8% was actually designed more than 10 years ago. And it was announced in the year 2018 based on the figures of the smoking rate in 2010. That we want to reduce the smoking rate by 30% as compared to the baseline year of 2010. So this is not something that we put up suddenly last night or last year. It's a long-term target, which I think is very important. It allowed us to move forward all the way in all the anti-smoking strategies. But we figure that this will be not be an easy task, but something which is difficult. We have to face the challenge, and that is one of the reasons that we this time we are putting up 10 measures together to try to move forward towards this target. I am confident that we will lower it further, and our target is still 7.8%. About the timing of the alternative smoking products, I'll ask Eddie to answer the question.
Okay. Thank you for the questions. I think for the banning of possession of ASP, our plan is first we introduce legislative amendment so that we could provide an effective date or to effect such banning. But the exact timeline of this effective date, I think we still have to decide. But the key message to the society is that actually the ban on ASP was already in effect in April 2022, which is 2 years ago, which means for 2 years already, the ban has already been in place. One should not be able to have any legal means to purchase or to get hold of such ASP. So anyone who is still using ASP currently, presumably they are using the stocks that they purchased before April 2022, which means 2 years ago. So a reasonable assumption is that by certain time, everyone, if they possessed any ASP, should have already consumed all of the remaining leftover.
我哋答多最後兩位記者嘅問題。
Let us take 2 more questions. This lady in the middle. I'm from RTHK. Good afternoon. Now, there are 10 short-term measures that will be included in the legislative amendment proposal to be submitted by the end of the year. Do you have any target as to when these 10 measures will be implemented, such as banning possession of ASPs or prohibiting smoking while queuing? Will you be able to meet the target of smoking prevalence of 7.8% by next year? And after introducing these 10 measures, how do you expect the smoking prevalence to drop further? And about the definition of queuing, how do you define that? Is it that if you have more than one person standing together, that will form a queue? And if somebody smokes not in the queue but next to the queue, then will he be breaching the law? We plan to introduce the legislative amendments to the Legislative Council within this year. The target is for the bill to be passed before the end of the legislative session. As to exactly when the measures will be implemented, that depends. Say for ASPs, there may be unfinished stock of ASPs, so we need to give a grace period for these ASPs to be disposed of. But all in all, we hope that the bill can be passed before the end of 2024. And to answer your next question on smoking prevalence, the target is 7.8%. This target was set many years ago as a long-term target. We are going to do our level best, and that is why we will roll out these measures as quickly as possible. We will also take a multi-pronged approach on tobacco control. We are confident in meeting the target. On the definition of queuing, I'll give the floor to Deputy Secretary Mr. Lee. As I said just now, queuing is something that is easy to understand. It's a common scene day in, day out. Definitely, if you're in the queue, you know that there is a queue. There won't be anyone who is in the queue not to their knowledge. So you ask about somebody smoking next to the queue. That depends on whether the smoker is in the queue. If the smoker is in the queue, it is impossible that they have no idea they are actually in the queue. This is just common knowledge. A queue comes in an orderly fashion. But as I said, banning smoking while queuing entails a shift of mindset, and that is why we need to create or foster a culture together. We should all say no to smoking while queuing, and that is why we are going to take a gradual approach. Whilst waiting for public transport, whilst queuing for entry into certain places such as amusement parks, these will be the subject of the new measure as a start. And about fostering a smoke-free culture, I believe that once we have achieved success, there won't be any smoker smoking right next to a queue. Next question, the bespectacled gentleman in the middle in blue. I'm from Economic Times. Good afternoon. The consultation document refers to banning the possession of tobacco products by people under the age of 18, and there are two different types of persons: those supplying tobacco products to the underage and those in possession. Will both incur criminal liability? That is, the ones supplying cigarettes and the ones in possession of the cigarettes. And you also mentioned another measure, that is the introduction of no smoking areas in places such as outside hospitals and residential care homes. Is the government going to specify the size of the NSAs outside these venues? Because the DS mentioned that a gradual approach will be taken. Then will all public areas become non-smoking areas eventually?
Deputy Secretary, on providing tobacco products to people aged under 18, well, our measure is that no one can provide tobacco products to minors. That is, it is the providers who are criminally liable. This is because it is up to the providers whether or not they want to provide free tobacco products to the underaged. We want to, through legislations, prohibit people from offering tobacco products to the underaged. On the question about NSAs, well, I was talking about designated areas around certain premises. I also referred to the entry and exit areas of premises like elderly homes or childcare centers, where we will specify the size of these entry and exit points or areas later. On offering tobacco products to those aged below 18, well, we want to protect our next generation. We want to protect our young people. Tobacco products contain over 7,000 types of chemicals. 70 of them are carcinogenic. Offering free tobacco products to minors can cause great harm to the health of our young people. If people aged below 18 are prohibited from purchasing tobacco products, you can well imagine that an adult may buy a pack of cigarettes and pass it to a young person. And this is harmful to the young person. We want to protect our children. We want to protect the underaged. We want to prevent any mistreatment to our young people. If these tobacco products are hazardous to the health of our young people, for young people who do not have the right or freedom to decide on what they're going to do, well, we should ban people from offering free tobacco products to young people. Otherwise, it would run counter to our existing legislations. Speaker off the mic. Well, in this regard, for a person aged below 18, if they possess any tobacco products, we will conduct investigations. It is like investigating cases of abusing children. We have to investigate who are offering tobacco products to the young person concerned. It is like investigating child abuse cases. there are similarities in the process of such investigations. That's all for the press conference today. Thank you. This is the end of the press conference. Thank you.